Yacht welcome to Four Directions of Wellness. I'm Roberta Diswood. Twobahanishle, Sisakadni Bashachin, Na Kaidene Dashache, Hanahni Dashanelle. Instead of opening the show with a question for our guests, I'd like to ask you, the audience, a question. When are you planning on having your next child? Today's show will address why we are asking this question and the importance of preconception planning. With us today is Shelley Thorkelson, Diabetes and Pregnancy Nurse Specialist at Health Education Center for Wellness at Northern Navajo Medical Center. Go ahead and introduce yourself, Shelley.
I'm Shelley Thorkelson. To introduce you in the traditional way, I was born to the Irish people, but born for Oakfalia clan, which in the Chickasaw language means tall people, which is kind of appropriate since I'm 6 feet tall. I've been here at Northern Navajo. In July it will be 20 years. I came here nearly 20 years ago to honor my father's spirit. He passed, unfortunately, from diabetes. So this has been my journey to take care of Native families in honor of him.
Well, thank you for being here today. Tell us, what is preconception planning?
Well, for anyone who is planning their family, it's very important to ensure the most healthy level of a woman prior to that pregnancy. So it's important to have a visit with her provider before a pregnancy to make sure that everything is as healthy as possible before a baby starts.
So tell me, why is it important to, plan out your pregnancy, especially for women with diabetes?
Well, for a woman with diabetes, it's important to have your blood sugars into control. And it's very important from the standpoint of the health of the uterus, because that is where the baby starts. From the standpoint of diabetes, we look at many lab values, and one of the easiest lab values to think about is the hemoglobin A1C. That lab value tells us essentially how much sugar coating the cells have, and that number is real easy to remember. In pregnancy, we want an A1C of 6% or less before a baby starts. So we want women who are planning to have their next child to check that lab value with their provider to make sure that their A1C is in that range of 6% or less.
Mm-hmm. So talking about, A1Cs, so can you tell me more about what healthy fertilization, you talked about the uterus, what it looks like for a woman who has a healthy A1C as opposed to somebody who has a high A1C.
Sure. Well, a good way to picture an A1C, think of an A1C like the sugar coating on cells. We want a very thin sugar coating around the cell, because that's a healthy cell with a very thin sugar coating, that's 6% A1C. So a cell would look like a Skittle, where the cell is the rubbery part of the Skittle, and then the sugar coating is that thin candy layer. And then when you picture a uterus lined in those kinds of cells, like Skittles, then when the implantation occurs, getting that implantation or that baby to stick on the side of the uterus through a very thin layer of fuel or a thin layer of sugar, that Skittle layer, it's real easy to reach that rubbery surface because there's just a thin layer of fuel for that implantation to happen. So that uterus is very healthy, very thin layer of Skittle cells. That's what we want. An A1C of, say, 11% would be cells that look like peanut M&Ms, where the cell is the peanut, but the sugar coating is very thick, like the chocolatey part of a peanut M&M. So that sugar coating is way too thick. So if you lined a uterus with peanut M&Ms, and then that egg had to come down and implant and find that peanut layer, So the implantation had to dig through this thick layer of sludge to get to the peanut layer. It's a much harder job. And then if the implantation is successful and a baby does start, there is a toxic layer of sugar that is providing the fuel for the beginning of a baby in that situation, and it's a sick layer of fuel. It's not a healthy start to a pregnancy. An A1C of 11 is maybe an average blood sugar of, let's say, 300. And that's just not a healthy layer of cells for a baby to start. So we want that skittle layer, essentially, for a way to picture it. We want the cells to have a very thin coating of sugar, as opposed to that very thick coating of sugar that you see in cells of someone who has a very high A1C. So when moms come in to talk to us about planning their pregnancy, the A1C is one of the tests that we do to see what average blood sugar has been for the last several months, so that we can better help her figure out what medications she might need, or if she's on medications already, what doses might be a better source for her, just to help her get her blood sugars back into control. It's not hard once we know what those numbers are.
And so you talked about unhealthy, a beginning. Are there any sort of things that can happen?
Sure. As the baby starts to form, if the lining of the uterus is producing a normal amount of fuel for all those parts to grow, then it's a healthy start for all those parts to start to grow. If a baby starts in a uterus that has an unhealthy layer of fuel, then we see a higher risk for parts not forming correctly. So that's why we want babies to grow in that normal fuel or that normal sugar layer, because we have much less risk of babies growing with parts that don't form correctly. So if we have babies growing under an A1C level of 6 or less, then our risk of having babies with parts that don't form correctly is much less. So that's why we want the babies to grow normal and have normal parts with a normal level of fuel. And then later on, after their parts are formed all normal, then later on when they start to grow fast at the end of pregnancy, it's also really important to have normal blood sugars at that time during pregnancy, so the babies don't get too big, because we don't want moms to have to push out these big center fielders either at the very end of pregnancy. And a normal size baby, a baby who's not born too fat, then when they grow up to become adults, they have much less risk of being too heavy as adults as well, and less risk of all of the diseases that can go along with that, like high blood pressure and diabetes and the things that can go along with being too heavy. So if a baby is born normal size, it's also our goal as well. So that's very important too.
Well, it's good to know. Is there any sort of final advice that you would give to women who are planning a pregnancy?
Come see me. And I never require appointments. It's an open door policy in the Health Education Center. All they have to do is just ask for Shelley. And since I'm pretty much one of, I think, 2 Shelleys in the building, and we've both worked here about 20 or 30 years, you pretty much just ask for Shelley and everybody knows which one's the tall one. And you just go to the Health Education Department and there I am.
Okay.
And there's never appointment required.
Okay. All right. Well, I want to thank you, Shelley, for being here today.
Welcome.
This has been 4 Directions of Wellness. Helgonet.